So I'm going to talk today about healthcare ecosystem, security's role in helping health tech find its way. Back in 2016, I was starting to look for a new job, and I really wanted to go work at a small company. And I wanted to find someone who would actually hire a security person at a really small company. And around the same time, Avi Rubin gave a talk at Enigma about health IT security. And this was really a good moment for me because I wanted to find a way to help people while doing security. And health tech seemed like a great opportunity. When I talk about health tech, I'm really talking about technology-enabled healthcare products or services, typically things that are available outside traditional medical establishments. It's a huge area of investment now and for the past few years. Just calling out that in 2021, there was over $20 billion investment in the first 9 months. And the reasons are pretty obvious, I think. Most people are just really looking for the same convenience and accessibility they see in consumer services. And the pandemic has obviously driven this even more. So I spent 2 years at a mobile medication management app, and then I joined a digital pharmacy to run the security program. And in both cases, I was the first security hire and got to build the team and build the security program. And I went through a high trust certification in one of the cases. So I'm going to start by talking what healthcare looks like when you start kind of understanding the relationships. When you go to a doctor's office, you might initially be redirected to a scheduling service where you interact with them in order to actually schedule your appointment. Once you show up at the doctor's office, your information is going to be recorded in an electronic health record. Your doctor might send a prescription to a pharmacy for you, and then after you leave, the doctor is going to use a claims processor in order to bill the health insurance company for the care they just delivered. These relationships are very well defined, and there are rules about how information moves between these organizations. In particular, any information that is collected about a person's health by or for a covered entity, that's what we call protected health information. And in this case, the covered entities are the healthcare organizations have direct relationships with the patient. So that's the health insurance plan, the doctor, and the pharmacy. Each of these covered entities is going to have different organizations that help them deliver that care, and these are their business associates. In this case, the claims processor is a business associate. The health insurance company and the electronic health record and scheduling service, those are going to be business associates of the doctor. And there are a bunch of rules, usually collectively referred to as HIPAA, even if that isn't actually what they are, that pretty much describe how you should do these things, how this information should be collected, how it should be shared, and how it should be protected. This is really an ecosystem, and every ecosystem has a food chain. The covered entities are essentially the carnivores. The providers like doctors and hospitals, and the pharmacies as well. Health plans are also covered entities, including insurance companies, government, and employer-sponsored health plans. They also include they make use of these business associates, which are essentially the herbivores in this ecosystem. So it could be very specific healthcare services, such as e-prescribing or claims processing. It also is just generic services. Pretty much every IT service, everything from your AWS hosting service to your actual, any cloud hosting you do, any email, any of that is going to end up being almost certainly a business associate. The apex predators in this ecosystem, those are the big enterprise healthcare organizations. In this case, the example I gave before, if that doctor was actually part of a health provider network, they would have rules that they were following based on that health provider that dictated how they handle information and how they do security. And they're going to pass those rules down to the messaging service. So you can think of this as sort of being a food chain. Why are we talking about the ecosystem? It's because there are forces that are acting on security in the healthcare ecosystem that are a little bit different. And understanding those are going to help you make decisions as a security practitioner. I like to think of some of these forces as being the weather. Regulatory is really driving a lot of what happens in healthcare security. There's HIPAA and other laws which those regulations are then interpreted by different organizations such as Health and Human Services, and then that guidance that HHS publishes is interpreted by various companies, and that becomes sort of the industry standard. So all these regulatory forces can have interesting impacts. The example I like to give is that HHS has established that fax is considered a secure transmission method if the recipient's fax number can be confirmed. However, because email transmits data electronically, the guidance is less specific, and many healthcare entities ban its use for transmitting PHI. The result is that the healthcare ecosystem falls back to faxing time and time again, despite it being an incredibly unreliable transmission mechanism, and the actual market for electronic faxes is incredibly unhealthy. One of my providers went to find a second eFax provider because our first was so unreliable, and we discovered that half of the supposedly HIPAA compliant vendors are owned by the same parent company. And most of them can't actually prove anything resembling HIPAA compliance. Another force within the healthcare ecosystem is third-party risk. It's kind of the pollution. It's the pollution of every ecosystem. It's certainly not unique to healthcare, but because of the regulatory framework, every covered entity and business associate is required to complete a risk assessment, have a business associate agreement specifying how data can be used, how it must be protected, and all of these business associate agreements require subcontractors to be bound by the same or stricter requirements. This can have really different impacts than you might see in other networks. I mentioned one breach where, because these vendors tend to consolidate within the healthcare network, there was a Capture RX breach that impacted over 1 million patients because so many hospitals use the exact same vendor, and it was a really appealing target for an attacker. Another impact you see is that the same breach might feel really different in the healthcare environment. Many people might be familiar with last year, a surveillance camera manufacturer called Verkada had a breach. So their cloud storage was actually breached. And this impacted a lot of companies. I think some of us saw the video cam footage of Okta's hallways. It was really different for a psychiatric hospital that was also impacted by that breach. The impact that we see in the overall healthcare ecosystem is that this limits the pools of vendors to either more mature vendors that are actually equipped to handle this risk, or maybe more mature and legacy, or those that are unable to live up to the requirements but are willing to sign a business associate agreement anyway. So it can be really challenging to actually bring on vendors, and in particular, a lot of infrastructure and data vendors that are common in other small companies aren't available to those who have healthcare data. Another force we see in healthcare is adaptation. One thing I've seen a lot of is consumer health and wellness companies actually have different requirements. They are not bound by HIPAA. They do have other privacy requirements, but they don't have to handle PHI, so they can avoid some of these impacts. They maybe don't have the same requirements around third-party risk. So a lot of companies will initially offer consumer health services and then actually face an uphill battle when they try to achieve HIPAA compliance at a later point in time, having made different choices early on. Last force I wanted to mention is the invasive species of the ecosystem, which is certifications. Invasive species are often introduced for perfectly good reasons. The example I like to give here is I live in San Francisco, and when there's a bunch of overgrowth, they'll drop off some goats and leave them there for a couple days to clear it all out. And this is great. You end up with a very empty area that doesn't have any of this overgrowth, but if they stayed for a long time, they would start actually eating the trees. So when you introduce an invasive species, often it's done for a good reason, but it can have unexpected impacts. And in this case, the certifications are an attempt to standardize third-party risk and assessments and simplify vendor management, but they push outdated security controls and may fail to reduce risk in modern environments and crowd out more effective controls and impactful business associates. So an organization that gets that certification is going to be more successful, even if they maybe got it not by being more secure. So now we've talked a little about the overall ecosystem. I want to talk about why I think there's actually a great opportunity for health tech to succeed in this and how security can actually be part of that success. One strategy that health tech has been pursuing is finding a small niche. Health tech can often scale up in specific areas by eliminating in-person care, physical proximity, and more complex care cases. A couple examples that I can think of off the top of my head are mental health. Telehealth therapy has been huge, especially in the past couple years. And it's also been really important for things like birth control, which used to require going in person for what is a fairly routine prescription. You can now do a telehealth visit and have it delivered to your door a very seamless process. Security has the opportunity here to avoid legacy risk. This is what I thought when I was getting into health tech I would get to do, which is just kind of start over from modern building blocks and avoid the legacy hardware and software, reduce the reliance on physical access and networks, and a more centralized model, because a lot of healthcare entities are small providers' offices, and they don't have the technical resources to implement the right security controls. So by centralizing it, you have the opportunity to do so. Another survival strategy that we see in a lot of health tech companies is convenience. Patients find receiving care challenging because they cannot get to the right location, they can't be there at the right time. Health tech startups that focus on telehealth delivery and making accessing care more convenient attract patients and actually are really appealing to the payers, the insurance companies, and even the employer sometimes, because they encourage preventative care. Some great examples of this are digital pharmacies. And remote physical therapy is one that I came across recently, which I thought was brilliant because I personally have been in a position where I just didn't get physical therapy for an injury because I could not make an appointment during business hours. The security opportunity here to me is giving patients control. Because these startups are based on the idea of convenience, there's the opportunity to avoid some of healthcare organizations' often paternalistic ideas of how to secure patient data. HIPAA was intended to allow patients to actually move their data around, so we should actually support that. But we need to educate patients and allow them to understand the choices that they're making about authentication, communication choices, authorization. I actually did a project at one of my employers where we reworked the way in which patients opted into authorizing putting protected health information in text messages. I personally don't want any of my PHI in text messages, but by working with our product and design team to build a workflow that was really clear and people knew exactly what they're doing, that was work I was very proud of. I was especially proud when I went to a large healthcare organization and was checking out to pay for a visit and accidentally opted into PHI and text messages because they put their workflow in the middle of the payment flow. And I was just clicking through it, and I authorized it without even realizing what I was doing. So this is a place where security can actually make a difference in terms of educating patients. The last survival strategy I'd like to talk about is skipping HIPAA. As I mentioned, consumer wellness startups are not acting as a healthcare provider or business associate, and they may not be subject to HIPAA for a while. But they still have to abide by other privacy laws and that often can be less burdensome, especially for an organization that's not ready to manage third-party risk the way HIPAA requires. Examples of this are fitness trackers and medication management approaches. And the opportunity here as a security person is to actually really do the risk identification up front. You're going to have to be doing some risk identification for the privacy rules that are in play, CCPA, GDPR, or others. So you can also start to think forward, because if you are at an organization that's going to be thinking about HIPAA, you have the opportunity to see that coming. Track the vendors, see which ones are HIPAA compliant. Track which data is identifiable, because that becomes really important as you move into handling PHI. And finally, require an auditable record of all access to user data by services, employees, and partners. This seems like something every organization should do. Unfortunately, it's not, and it's the one that hurts the most when you start really getting into handling some of the requirements around HIPAA. So I did this for 5 years, and then just about a month before this talk, I quit my job. So I think one of the things I wanted to talk a little bit about is whether I still feel the same way about security's ability to impact health tech. And the answer is yes. I think there's still a lot of opportunity for security to come into a health tech organization and make a difference in how they handle data. I think it's really important to go in and actually understand why that organization is asking you to come. I think it's really important to understand their motivations. There was a talk earlier today where they mentioned that sometimes a CISO is hired purely for regulatory or reputational reasons. That does happen in health tech, and that's definitely something anyone that's going into this area should be thinking about and considering if that's what's going on. But at the same time, every single one of these organizations that I've worked at or talked to, everyone actually does want to do the right thing. One of the things I've been really impressed with is when I talk to an engineer at one of these companies, part of the reason they're there is because they believe in the mission and they want to do the right thing. So the answer is yes, this is a really important work, and I think more people should be actively trying to be in the area, but also you should go into it understanding what the motivations are, and you should go into it understanding that we are still in healthcare. I mentioned Avi Rubin's talk at the beginning of this because I went back and watched it actually the other day, and it was very, I probably should have watched it more often. There are some fundamental truths I've learned about healthcare security in the past 5 years, even in health tech. First and foremost, confidentiality is not the top of the confidentiality, integrity, and availability triangle for healthcare. At the end of the day, the most important thing is delivering care to patients, and that is where the priority will be. So integrity and availability are incredibly important and often more important than confidentiality. Second thing I learned is that regulators drive healthcare security, not technology. There might be a better technology available that would reduce risk, but if it does not fit with the way regulators think about security, you might not be able to do it. And so you have to be very realistic about that, and you have to understand what the rules are. Because if you do not understand the rules, it doesn't matter if you're reducing risk. That's not going to help the organization you're working at succeed. Third-party risk is a lot of the job. I think that's one thing is that if you're not willing to engage with third-party risk, you probably can find someplace else to work, because I cannot think of any place in health tech that doesn't involve third-party risk. And finally, facts will never die. There is nothing that will kill it. I came in thinking I'm gonna not have to work with it. We're gonna find a way to avoid it, and it's there. It's always gonna be there. We cannot avoid it. And on that note, I'm done.